is no cure for bipolar disorder. Patients diagnosed with the mood disorder often have to cope with the illness for the rest of their lives. While doctors say the mainstay of treatment is taking mood stabilizers, Daren and Kah Ying say that medication has not helped them.
Taking the meds is one thing, but living with the side effects is another thing. There were a lot of side effects. I will be dry in the mouth 24/7. That will happen with any antidepressants, in fact, the dry mouth. But the lithium was, you could go and take a dump, and you can actually smell the metal, you know what I'm saying? So I was living with all that, and I was thinking, you know what, I don't mind if I bloat up to a balloon also, it doesn't matter. What matters is up here. If this was stable, I don't care if I bloat up. But I was bloating up and this wasn't going away, it was coming back.
Although medications understandably may have certain adverse effects and side effects, for the most part, we are able to individualize treatment for the individual patient such that these side effects are quite minimal and quite well tolerated over time. There are many patients who want to stop medication for a whole variety of reasons. Some people just find that after they feel better, they don't feel a need for medication. But indeed, the problem here is that for many patients, we emphasize that continued treatment, even when they are ostensibly well, is to actually prevent a relapse from occurring. Others may seemingly be able to get away with just short-term treatment for the episode, and after they recover, they can stay well for extended periods, sometimes even without continued medication. But again, usually for those who have a tendency to relapse, we would highly recommend that they continue. Depending on the medications that are used, for example, some of the anti-manic medications may be associated with things like weight gain or sedation. Some of the mood control medications may be associated with things like acne. So I think for each of the medications that we select and use for the patient, we will actually counsel the patients and explain what are some of the possible corrective actions that can be instituted. So for example, a healthy diet and an exercise plan in conjunction with the use of a particular medication can still, manage to keep the patient well and healthy despite their continuing on the medication.
The best treatment would be a combination of both, because the medication is going to work on their biological functioning, whereas the counseling is going to deal with all the family, work and personal difficulties that they run into.
Both Daren and Kah Ying are no longer on medication. Neither of them consulted their doctors when they did so.
I was quite angry with the psychiatrist. I thought, because my mother, she was a dressmaker, so I feel like she was just handing money, at the time I felt there's so much money to give medication that just doesn't work. So I felt very angry. Sometimes I remember thinking when one time I saw my mother giving over the money, I always wanted to grab the money out of her hands, you don't want to come here anymore, don't buy any more medication, it's not working, I don't care, I don't want it.
Well, sometimes there are scary situations, like when a patient decides to stop medication when he's not ready to, because he feels good, and he starts having a manic phase, so you might not see the client because they feel good, they just feel that they don't need anyone anymore. The worst thing is to find them hospitalized for attempted suicide.
I was very keen to, breastfeed my son because this was very important to me, And so I was like, I'm breastfeeding. So then he said, well, you should just go on this medication. So I said, does that mean you have to stop breastfeeding? And the guy said, yeah. Then my first impulse was just go, okay, let's just hold off on it until I've breastfed him to, for a certain amount of period of time or something. And then the guy just kind of looked at me and said, look, I said, I know you really want to take care of your son. So he said, but if you want to take care of him in the long term, you need to go on medication. And I think that was really like a clincher line for me.
Pregnancy is a stressful time, regardless of the hormones or not. You're looking at a totally new change of life, a new role in your life, a new addition to your family life, and it can be a stressful period. Some of the medications, in fact, quite a number of medications used in bipolar disorder are not suitable for mothers or pregnant women. Patients who are planning to get pregnant with bipolar disorder, it should be a planned pregnancy. It should be carefully discussed with both the attending psychiatrist as well as the attending obstetrician and it should be very closely monitored, because then you will try to change the medications or minimize the medications as much as possible, but you need very close follow-up because it's a stressful period.
As if bipolar patients didn't have enough to deal with, they have to defend themselves from the prejudices of others too. In the next clip, we talk about the stigma associated with bipolar disorder.
I wake up in the morning, I need